Hello and a very good afternoon to you. You're watching News 9 Digital. I'm Pratibha. Thank you for joining me live today. Whenever we speak about coronavirus, it's usually seen through the prism of age. Those who are elderly need to be protected more because of comorbidities and the susceptibility to catch coronavirus as well. And this is something that has been discussed right from the beginning of the pandemic. In fact, it has also affected the decision making, the policy making as well, when the government rules were announced regarding the same as well. In fact, it's also going to be a factor when the vaccine distribution starts. But now a new study suggests that age is not a factor when it comes to susceptibility of catching coronavirus, which means that age is not a factor on the probability of you getting coronavirus. While this might be quite a welcome sign, it does not mean that the elderly can rest assured completely or can let their guard down, because there are various factors. In fact, when we look at the mortality rate as well, as we speak about COVID-19, and the mortality that it has caused, then we look at the age. Those who are above 60, the number of deaths have been quite high as well. But this is because of two reasons. The first one being, of course, like we said, the susceptibility. What was thought until now, that those who are elderly are at a much higher risk of catching coronavirus. And the second factor, of course, being comorbidities. Despite what the study has said, that's still going to be a factor. So what does this study mean? Does it mean that, as far as policy changes are concerned, that should be something that should be thought of? To discuss more on this, joining me live is Dr. Raghu J, Senior Consultant of Internal Medicine from the Sakra World Hospital. Dr. Raghu, many thanks for joining us. This is a study that is completely contradictory to what we know until now. There were fears that the elderly are more susceptible to catching COVID-19, but that's not the case. A mathematical model was also formed by this study and to study how susceptible the elderly are, but that's not the case. But of course, that does not mean that the elderly can let their guard down, isn't it? How do you look at it?
Yes, of course. There is a new study which has been studied in the Japan, which is released on October 12. Rightly said, madam. You rightly said. See, there are scientists have estimated that age of an individual does not indicate how likely they are to be infected. And any age, for that matter, everyone is susceptible for the COVID-19. As you rightly mentioned just now, so as the age advances, the more people they have the more comorbid conditions like diabetes, hypertension, heart disease, any kidney disease. They are susceptible, they develop severe symptoms and show higher mortality or death rate when compared to the younger age. So there are various factors in which we look at it, why the elderly people or individuals may be due to various factors. So one is how likely they are to be infected due to their advanced age. Is reflected in the number of cases and how likely they will be affected by a severe form of the disease due to their advanced age. So this is how the mortality rate. The study they have taken from the Japan, Spain, Italy, where they have studied their susceptibility and severity. Both they have taken from the beginning of the coronavirus in these countries. So the mathematical, as you said, the mathematical model to susceptibility each age group in a different conditions they have taken. But definitely every age, from whether it is from the less than 10 years, 10 to 19 years, like they have categorized, 20 to 29 years, 30 to 9. So they have seen that all the age are susceptible for the COVID-19. But the mortality rate is very, very high in between 70 plus. So we have seen a significant proportion of mortality or the death rate or severity of the disease in 70 plus. Second comes the 60 to 69 years, and third it will comes the 50 to 59 years, of course. And this age around 30 to 39, 20 to 29, 10 to 19 years, they are not susceptible to mortality, but they are susceptible to the disease, definitely.
Okay. In fact, in this study as well, they had also taken a look at the human-to-human contact. So, would you say that's a factor as well? Because, for the elderly, the human-to-human contact might, in several cases, be much lower than it is, say, perhaps for a lower age group, because they go out more, they're interacting with more people as well. So, would that be a factor as well in the susceptibility of catching coronavirus?
Sure, madam. That is also there because they, of course, there the movement, gathering. all these things are the human to human transmission is definitely it is there when compared to the younger children, where of course they are restricted to their home or class or like that until unless because and of course all the governments throughout the world, including WHO, they have made restriction of the children to go to schools, colleges, and so that's how they prevented the human to human transmission. Of course, elderly people are more susceptible to outdoor activities. Maybe they are going to office or whatever. So that's how it has been definitely impact.
Okay, so lastly, it might be a breakthrough in terms of we know a lot more of coronavirus than we did before, because we were of the assumption until now scientists believe that age would also mean more susceptibility, but mortality is still a factor, and that's because of the underlying conditions that the elderly face, which means that we still, the elderly still are a part of the vulnerable group, isn't it? And when it comes to vaccination, when it comes to taking any other precautions as well, we need to be more protective of this group.
True, madam. So those who are vulnerable, so of course, definitely they have to be taken prioritize for the vaccination.
Yeah.
And of course, each age would be susceptible. I'm not denying that one. Only thing is, as you mentioned earlier, human to human contact level in each group, as well as varying restriction levels of outside home activities, was the main factor which has been seeing more susceptible in elderly people.
Okay.
Of course, as you we already mentioned, the diabetes, hypertension, heart disease, kidney disease, and of course the pregnant ladies are more susceptible for the infection. There should be prioritized for the vaccination. And of course, those who are working for the protection, the healthcare workers, and those who are with the public, like the police, all these things they have to be given more preference for the vaccination.
Okay. All right. Dr. Raghu, many thanks for joining us live with your expertise on the subject. So this is a study that has thrown light on how susceptible a person is to coronavirus. Unlike what was believed before, the elderly, age is not really a factor when it comes to susceptibility. But of course, in mortality, age still remains a factor, which means that the elderly still remain in the vulnerable group and they need to be more protected. And this is the reason why different rules are formed. This is the reason why even when it comes to vaccination, what would be in focus is the vulnerable group immediately after the healthcare workers and the other frontline workers. But of course, this also means that as the day progresses, as the days go on, we know more and more about coronavirus. This is a study in terms of breakthrough on the susceptibility and, having more information on that. But it also means that we can't let our guard down. We need to protect those who are vulnerable, ensure that we take the precautions that we have until now, which means continue wearing masks, continue ensuring that you are keeping physical distance with others, and also maintain personal hygiene at all costs. Well, that's all I have for you today. Thank you so much for watching me. I'll look forward to your comments on the subject as well. Thank you for watching. Take care.